The next question is from Mehul. I think I've answered this already with the Tahura. How to get approved my dissertation? What was completed in India? Makes that sense? No, sorry, no, it doesn't make any sense. In India, if a thesis is a compulsion during your postgraduate training, uh, you, as I said, Tahura, that you can get it publicized and write it in your CV that you have on paper, but it will not be counted for your promotion in Germany at all. If you want to get promoted here, you have to write a new thesis.
Okay, Sandesh, I'll take a question from Sandesh.
Mhm.
Yes, Sandesh, go ahead.
Yeah. So I have two questions, like one on the research side of it. Abhinav initially mentioned that during his experimental promotion, he
Mhm.
got like 1 year break to do the lab
Yeah.
research. Is it something which is related or a part of your, was it a contract based this thing?
Uh,
Because I
Sandesh,
know few programs which are like
Sandesh, sorry, I can't hear you properly. Can you?
He asked that if that is a part of the contract, did they clear that before you got employed over there, or that did you clear that later on? That was the question, right, Sandesh?
See,
yeah, like is it like a handloom with your chef or is it based on a contract or
See, it is for handling with your chef or with your Oberarzt. The habilitator Oberarzt, they can give you even a research project, um, or with your chef asked. Generally, it is not included in your contract. But what you can do is you can, if you are actually interested in that, when you go for a job interview, you can clearly mention that okay, see, I'm very much research oriented. I want to do research. Um, you can even mention that I want to gain some lab experience and all. But this doesn't give you a guarantee that you will given a research project. You can just ask them. But no, sorry, it will not be included in your contract.
Yes, correct. As Vinod said, I also am the same opinion that it will not be included in your contract, but that will be your deciding factor or their deciding factor while employing you.
Yeah.
Okay, that they can tell you that I have been to interviews where after initially when we all start our jobs, we don't have much choices. We start anywhere we get, but later on when you get choices, then you do this for handloom during your interview. That okay, I mean I want this, and I mean, are you going to offer me that? So there have been people in big clinicum, Subhashpil Clinicum in Ingolstadt, the chef over there. He told me that, I mean, he tried to formulate it like this, that okay, in the future now, see, nobody is doing doctor about extra works. As surgeons, you need to learn operation, and I mean that was his thinking. And it's like, what, you are not going to pay anything extra for that. So but then basically he did not have the opportunities for a research project for like a promotion for me. So then he was very clear, he told me, and then I decided, okay, fine, I mean, I know the facts now. And there can be other places where they say in the during the interview that okay, fine, you come, we'll do everything, and we'll, I mean, that should not be the problem, we have the opportunities. But then when you join over there and 6 months are gone, I mean, 4 months are gone, and you still don't get any response like from them, then you should think again that you still have like I mean, you have, are you going to get it, or do you have to like search for other avenues? You have to see about that. So a first contract at the beginning, it is unlikely, but then you have to discuss that during an interview very clearly, that this is what I want, and do I will I get it? All right.
The next,
Okay. Yeah.
thank you. And I have one follow up on the clinical side of it. Like you guys have a lot more experience here working. So as and when you change jobs, like my thing is like whenever you change a job and go to a new place, there is always this pecking order which you have because there is no direct program based approach here.
Mhm.
So there is always this pecking order where once you change your job, you most often end up at a very low place and you'll have to work your way up. So, for
True.
example, when you're in doing a vital domain, internal medicine, so there are few departments where everyone wants to go. So, how were you guys able to deal with this? And like when you change the job, and that is one thing which will sometimes discourage you from changing the job. So, how how did you go about?
Deepak, you want to take it or shall I start?
Uh, I can start it. See, I would say that is why you have to change jobs very strategically. Okay, you don't have to do trial and error method. Initial first job is always, I mean, what you get, that I always say. But later on, as I mentioned in the previous question also, that you don't want to just keep switching every 6 months, every 1 year, because after you have done that 2 3 times in your CV, it looks very bad that this person does not stick. Okay, and then you will not get good opportunities future. In your interviews, they will ask you all the time that why have you changed so much. Now that was the question, like that was the answer, that you should not do that so often. Now, if you have to do it, then what you should do it and how do you come across this problem? Everybody agrees that with a job change, you lose at least 6 months of training. Okay, because you, as you rightly mentioned, that you end up at the end of the ladder. Okay, then there might be, if you're in third year, then there might be somebody who's in second year, but since he is there since 2 years and is now like one of the favorites and is also working very hard, so he will get more opportunities than you will get till the time you prove yourself in coming 6 months. And the 6 months, you are also not sure if you want to stay over there, because if you don't like it, you might leave, or they are also not sure if they want to have you. They will see you first for 5 months, 6 months, and then decide that, okay, are you going to stay there for long term, and then they will invest the time and efforts in you. So this is there that you lose 6 months. That is why you have to be very strategic. And obviously, there is no perfect answer to this. There is no formula. That is why we still patience and to make the best out of where you are. Because see, as I said, that every place has its pros and cons. Okay, it's not like one place is totally bad and one place is totally awesome. It's not like that. But even if you feel that you are at a bad place, you see that what best you can do, what best you can absorb from them. You make contacts with the connections over there, and these connections help you a lot later on. You get a lot of information. Abhinav.
I agree to you completely. I just want to add one point here. Uh, for that, also, you can do a sort of verhandlung in your job interview. You can say, okay, see, my clinical skills are in this particular field are limited to this, this, and this. What I am particularly interested is to learn this, this, and this. I want to have more opportunities in these fields. You can do a bit of verhandlung in your interviews as well.
Here, see, I will, I mean, just Anmerkung to this. The chef arts will never, if he likes you, he will say yes to everything.
Yeah.
Okay. But what actually happens, that you will find out after you join, and then it is too late.
So no, see, I guess here even is the social networking is very important. For example, if you know, you what you can also do is during your interview. That's what I did, in from the day one as well. From every single job, I asked them for 1 day of hospitations, and in the hospitations, then I try to talk to maximum number of assistants asked, though it is even not 100% perfect, because they will just want to advertise their hospital. They will say everything is good, everything is fine, and so on. But you can try to have an idea. Okay, if you're interested, for example, in particular kind of surgery, in the interview they will say, okay, yeah, we do hundreds of them every day, but in reality it may not be the situation. So what you can do is you can ask for 1 day of hospitation and try to ask the assistants or the residents over there who are already working, and ask them, okay, how much you do this kind of activities in this surgery for a month. Now this is one approach you can look for.
Yes, and it's also not only just during your interviews. You, when you are in choosing position, like after some FRO and all, you not only ask for what the things they do. Question important is that, see, at university, for example, at university hospitals, they do lots of complicated surgeries and lots of complicated. But who does that? Does the assistant arts? He does not even go in the operation. Like the chef arts or the Leitender Ober arts does that with the another FAC arts. Now, that is the truth of the big centers, where they say that, okay, there you do lots of opportunity, lots of research, lots of this thing, and you get a big name that you have worked over there. You learn many other things apart from the complex operations. So one might say that, okay, university, now we do major polytrauma, for example, like University SN is one of the major polytrauma centers here. So we see lots of major polytrauma. But I mean, I am not in the trauma, I'm in tumor department. So for me, it's egal. But then for people who are in trauma, do they even go in the bacon fracture operation, or do they even go in the complex thoracoabdominal traumas? They don't even go. because that is complex. That is why with this information, you do, as Abhinav said, that you go in hospitation, you ask these things that, okay, I mean, you see the OPE plan, for example, in surgical branches, in internist branches, you see Sprechstunde, how many people are there, how many assistant RCs, how is the dean's plan, okay? And another important thing is that how much money do they make? That is also important, because initially we are all like, okay, whatever you give, we are happy. But later on, you start comparing that other hospitals, other dean's plan, they earn much more. Like some people earn like, say, netto, I would say, I mean, grossly 3,500 or 4,000, and other hospitals they earn 5,500, 6,000. And so these things also one has to consider, like once you're advanced in your career. So this you learn from the dean's plan. You say dean's plan, how many stunda, how many deans one does, and how are the deans? Do you get to rest at night? Because depending upon that, you can do more number of deans, so you can earn more. I mean, if you are that kind of person who wants to earn through deans, I find it waste of time basically, because when you are working 24 hours over there. So, but these things have to be like taken care of during the interview and hospitation.
Yeah, that's why every time, if you are, my personal recommendation is go for 1 day of hospitation before you.
All right.
And we have then a question from Somik. What is the ideal time to send job applications? Before Berufserlaubnis, after Berufserlaubnis, or after approbation? We plan to do Weiterbildung in cardiology. I have applied for FSP in Sachsen, but got hospitation offer in Thüringen in cardiology. But I have to do hospitation till QnA Prüfung as per the Chefas. Is that a good choice to write the FSP in Sachsen and then transfer to Thüringen? I think Deepak, you are the best person to answer this.
See, you said that you are going to do FSP in Sachsen and then going to transfer for approbation. Yeah, fine. I mean, it's going to fine. You can do that. If your hospital in Thüringen is going to give you a contract on FSP based, like on Berufserlaubnis, you can start that and do the FSP over. I mean, the approbation in Thüringen already. And about when to apply for jobs. So I mean, you can keep. I always say that keep applying. You do 10 emails every day continuously throughout the year, because you might go to a news teller and in 2 months time you might not like it, and then you might want to change it, and then that time if you begin applying that time, then you need like more 2 months to get a position like or an interview. That's why you keep applying and keep a record that whom you are applying to and what you are doing. It's like that, I would say. Yes.
Is it that after applying, if I don't get any reply, after getting Berufserlaubnis, I the second time also send them a mail that I have got Berufserlaubnis, and
yes, you can apply. Yeah, that will show that you are persistent. I mean, persistent is not equally, like, not always equal to worthiness, but persistence still is a positive quality that shows that you are interested in their job over there, and they might consider to call you for an interview.
But at the Thüringen, as per the chef first, with Berufserlaubnis, I cannot work as an assistant nurse. They want me to fully clear my approbation prüfung. Then after.
You are working. How are you working at present? Are you working as assistant arts? Do you have a Fachsprachprüfung, right?
No. Just applied for the Fachsprachprüfung, not yet written it. But the Thüringen offer is that till up to Fachsprachprüfung, you won't get any option, and after that also you have to work till your Kenntnisse Prüfung.
That is a bad idea, because it's very, very likely that he will remove you because it takes too long.
Yeah,
you will not get termin for approbation. He will tell that, okay, I found somebody else, a Deutscher, or somebody with approbation already, with a few months of experience, or maybe a couple of years of experience, and then they don't have a place for you.
So, and then better to stay in Sachsen and
yes.
And one last question: in cardiology, Weiterbildung, do you get to learn interventional cardiology like angiography, angioplasty?
Later on. Not in the beginning. Later on, if you are good, if they like you, then in your 6th year you will learn, or maybe mostly people learn after Facharts.
Okay, after Facharts.
Mostly they learn after Facharts. People who are good, they learn in the 6th year. Okay.
And in the cardiology, there is 2 other Fach competencies. They said, so that means that maybe I can do in pneumology or in gastroenterology. any other
You can do initially, you can do rotations, and then after like 3 years, you can choose which one do you like and which one do you want to do, and then you can talk accordingly that I want more rotations over there. So when it is one clinic, then it's very like not what you say, not very fast that 3 years you will do one department only. It is like you might go for 6 months in another department to help them out to learn more things about that. So that is all internal Nishpresh that you have to do with the Shafats over there. But then don't expect that from second year or third year you will be doing catheterization in cardiology. It's not going to happen.
Here I want to add something as well, Samik. See, if you have to be sure about that, what you want to do, in what kind of specialty you want to land in, because the problem is, let's say you first decide, okay, I want to do my Fachast in medicine, and at the end of 5th year you decide, okay, I want to specialize in pulmonology, but you haven't done any rotation in pulmonology in your basic Fachast Weiterbildung, and then you will end up spending 3 years after that to get a pulmonologist specialization. So if you are clear about it, what you want to do, let's say for example cardiology as well, so make sure that in your basic Fachast Weiterbildung, you do at least 1 year of rotation in cardiology. Okay.
But as per the Weiterbildungsordnung, you have said that 3 years in internal medicine cardiology and 2 years in different other Fach competence, and 6 months.
Yeah. Here it is a gray zone. For example, there are many departments which are combined. For example, the clinic for gastroenterology, hematology, oncology, and so on. Now these are the clinic for internal medicine, but they are considered as specialized clinic as well. So at the end of the day, if your Shefast is ready for you to sign that, okay, he has done 1 year of Weiterbildung in gastroenterology, and your future aim is also gastroenterology, then it is okay. But you need to first of all you need to be sure in what kind of specialty you want to go in, and personally I will say you do at least 1 year of rotation in that specialty. So that which gets recognized. Otherwise you will end up spending after your Fachast in medicine 3 years for your specialty.
Actually, I wanted to only work in cardiology because I did a diploma cardiology also in India for 2 years. So I have experience in clinical cardiology, this section. So I'd like to go with cardiology only, but is it possible to do only in cardiology, or I have to do also, like, as you said, to...
Now see, you have, again, if you're pretty sure that you want to do in cardiology, you have two options. Most of my colleagues who are interested in cardiology, what they do is they look for a cardiology clinic, and they in their Vorstellungsgespräch, in their interview, they mention that we want to specialize in internal medicine as well, but my future aim is to become a cardiologist. So what the Shefas then do is they arrange the rotations so that you can rotate differently. See, here's a bit of gray zone. As I mentioned, yes, that's written in the Weiterbildung structure that you have to do 3 years in internal medicine. But the clinic for cardiology is considered a part of internal medicine as well.
Yeah.
Okay.
So, yeah, correct. Sorry for interruption. Please go ahead.
No problem. Go ahead. What you wanted to add?
No, yeah. So I wanted to just say that, see, when you are doing, I mean, in your case, it's sure that you want to become a cardiologist. Then if you communicate that accordingly, and when you're the most, I mean, the Fachas, when they write this Bescheinigung for you that this person can take the Fachas exam, there they just have to mention that you have done this rotation. So what they will do is that they will tell you that, okay, from this 6 years, you stay by us for 6 years. You do 6 months or say 1 year in other departments, like cardiology or gastroenterology or any other department that they have, so that it's not like, so that others might also get the chance to come in cardiology and do a rotation like that. But most of the time you will stay with them. That is what they can do the arrangement with you.
Yeah.
And that is what you can, and that is what I think is also fine, because you have to also understand that, okay, you are going to become cardiologist. If you now with this thought, a thought comes to me, like with this statement. if you are planning that, okay, in future you want to become a Oberarzt, okay, now you've become a cardiologist. The Oberarzt in a clinic, in a hospital, okay, not your private practice, your own, working in a hospital. There it might happen that there is a small hospital, they have different departments, and you need to have some idea about gastroenterology also. You need to have some idea about, say, rheumatology also, because you are going to work, you are going to see such patients also, maybe at least in Dienst, at least in note of Nama, in night time when the assistant arts has problems with that. So with the increase, that increases your competence. Okay, and with more competence, you become more employable in the future. Okay, so that is why I recommend that don't be so eingeschränkt, so subjective. That, see, if you plan to open your own practice in the future, like only cardiology, then it's fine. You don't have to worry about other departments. But it's good to have idea about other, because internist patient that you will have from cardiology, it will not be only cardiological patient. They will have many other things as well.
Okay.
All right.
Yeah.
So let's take the question from last question from Mehul, because now we are like it's 6:51. Our plan was till 6:30 only. We already exceeded time. We'll see a new entry from Dr. Ankita. We'll talk to her as well. Ankita, you have missed most of the session. We started like almost 2 hours back, but we'll talk to you once. If you have any specific questions, be ready. Mehul, please go ahead. Ask your question.
So my question is to you directly, which which I couldn't understand what you said on the previous answer. You told that when someone does Dienst in Uniclinic and over 24 hours Dienst, and that is the waste of time. I couldn't understand the point. What was that?
See, okay. See, now there are. See, that was my personal opinion, because see, when you talk very frankly, okay, you do Dienst, okay, 24 hours Dienst. How much you earn in that? You're working on a normal day, you earn 100 euro extra from that. Okay, 100 extra, as in a normal 16 hours one day. Monday, for example, I do, say, Tuesday Dienst. Okay, so I go to Tuesday and Wednesday. I would have worked for 16 hours totally. Instead of that, I go on Tuesday, I work 24 hours, and I come back on Wednesday back. So that means I have worked 24 hours. That is 8 hours additional. Now, 8 hours additional, how much do you get paid extra? Like 100 euro, something like that. Okay. Now, for 100 euro working like all night and working in so much stress, I find it like
yes,
that.
I second you. I second you on that.
That time could be used in many more productive things. That time you can spend with your family. That time you can and for me, I can do many other things in that time.
Correct.
Okay,
and I'm also the same opinion. I was also thinking the same.
If you're doing weekend deans, for example, or fire target deans, for example, today is Easter Freitag. People who do today, they will not be earning just 80 euros or 100 euros additionally. They will be earning 250 or 300 euros additionally. Now that is okay. Okay, if you're earning like 350 euros for one duty, for 124 hours duty, then you go and do that. But if it is just petty 100 euro, then it's not worth it. That is my opinion. I mean, somebody might find it important. And yes, a Dienst is important because it increases your capacity. It increases your Fähigkeit. You become more employable. That is why you should not totally give away. I will not do it. But then you should not do it because many people do it because of finances, because they will earn more money. People fight for Dienst, that okay, I will do 8 Dienst and 10 Dienst. It's not that I used to do that. I used to not fight for it, but I used to do many Dienst in my second year. Okay, but now I am like a little ahead of
saturated.
All right. So we'll take question from Ankita. What is the future of cosmetic surgery in Germany? Can you tell me the pathway? Cosmetic surgery.
Cosmetic surgery. It's from, I think you have 2 different pathways for that. I will take this, Deepak. Sorry, I broke it.
Yeah, no, it's okay.
I think there are 2 different pathways for that. One is through the dermatology, which is on personal experience very difficult for foreigners to get. The second way is the plastic and aesthetic surgery, which is again for foreigners will be very difficult to get initially. But in that case, what I can suggest is that you start from general surgery and you move your way up in the plastic surgery.
Okay, sir. Thank you.
Plastic surgery is a much more difficult way, I would say, because plastic surgery is mostly done by orthopedic and allgemein chirurgy, as Abhinav said, and then they later on do 2 years of Zusatzweiterbildung as plastic chirurg, and that is not done at smaller centers. Okay, so that is done mostly at university levels, and that means you'll have to gain entry at the university level. And when the pathway is from dermatology on aesthetic, there because that is done at the praxis level, at the clinic level, not at the hospital or university level. There, I believe, even though competition is higher as compared to getting into anesthesia or getting into internal medicine or general surgery, competition is there higher, but still it is much more easier as compared to becoming a plastic surgeon from a university.
Yes, dermatology is also difficult.
Competitive. Yes, it's competitive. I agree.
Yeah,
I agree.
If you are very keen on it, I will suggest that you start with internal medicine, because in your dermatology, in dermatology Weiterbildung, you can get 1 year of internal medicine licensed in your dermatology training. So you start from internal medicine. After 1 year or after 9 months, 10 months, you start applying for dermatology positions, and if you get one, then you won't lose any time.
We have to conclude it sometime soon. Questions. I mean, we have two more hands raised. Sayan, Ghosh, and Sagar. Sayan, we have not taken any question from you. I'll take a question from you, and then one more question from Sagar, and then we are going to conclude this. But it's already quite late.
Yeah.
Sayan, go ahead.
Hello.
Yes, please go ahead.
Hello, Deepak sir. Hello, Vinod sir.
Hello.
I have done MBBS in India in 2019, and since then I am working in ISO setup. And recently I have done HLS, BLS, and CAL course. And I have planned to do PG in internal medicine in Germany. I have done legalization and all the procedures. In this month, I will take the B1 exam. Sir, what will be the scope in internal medicine there, and how to choose the hospital?
Deepak, shall I go ahead with this?
Yes, please.
Sayan, the pathway is the same, what we have discussed till now. See, first of all, you get your B2 certificate, then you have two routes. You get the Berufserlaubnis and start working, or you apply for approbation directly, you get your approbation, and then you do a job search. There are 6 different ways how I mentioned the job search, but if you want to do it quickly, I would rather say then you get your approbation, and then you hire one of these job agencies, and you start with a job. With Berufserlaubnis, you can get a job, but it is a little bit difficult than the rather than approbation, and these job agencies will not entertain you on the Berufserlaubnis.
Yeah. Okay. Agree.
Okay.
Sayan, are you satisfied with the answer?
Yeah.
Wonderful.
And sir, what is the present payment scale in the temporary license and the permanent license?
There is no difference. See, there is no difference in the payment scale, but some hospitals exploit foreign doctors because they don't have permanent license, and they somehow want to get into the system. That is why they give you an option that, okay, we will employ you, but only pay you €1,000 or something like that. If possible, one should avoid such exploitations because you are going to work same as the native German doctor or the appropriate doctor, so you should not get paid less. It creates bad example for all other doctors who are working, and one should fight against it. But many times people don't have a choice, and many things, visa and personal expenses and everything depend upon that. So people in that helplessness take such jobs.
Okay.
So Sagar, please go ahead and.
Yes, sir. The job opportunities in Germany was very good until the pandemic came, and hence I've decided to only come for the writing the Fachsprachenprüfung and just go back by applying Schengen visa and not by coming with 16D visa, which was the earliest option before.
Yeah.
is the decision right at the present moment, or should I come with 16D and spend my blocked amount and wait for the job?
No, I don't think you should do that. You should come with first pass the Fachsprachprüfung and then like see how it goes further. Because coming, as you said, that things have changed in last. I mean, it was never easy to get a job. The things that I hear now, it's getting it has become difficult. It was difficult all like 5 years back as well, or 6 years back as well. So it was never difficult. I used to hear in 2014 also that okay, now nobody's getting a job, but we managed somehow. And people are managing even now. Like I know many of the from these participants, I know few of them, and they were also in difficult situations, and they also got a job. So everybody, I mean, things work out. Persistence is required. Your strategy that you should come first, take Fachsprachprüfung is good. You should follow that.
But does it matter that the hospital will decide whether he's in India, or is it he's in Germany and then decide about whether giving the
No, if your Fachsprachprüfung is cleared, if you have Berufserlaubnis, then you can catch a flight like in 2 weeks and come if they like want to hire you. Okay.
Exactly.
The problem is with the Fachsprachprüfung and the paperwork.
Okay, sir.
All right.
Okay.
All right, then here we are going to conclude here. I thank you all for participation. I thank Abhinav for his efforts that he has taken to present this webinar today. And yeah, we did not talk much about the association. We got somewhat sidelined with the consulting things, which I did not want to take. But then now, I mean, when we are here, then might as well answer those questions instead of just ignoring them. So yeah, we know about this association, that okay, the purpose, vision, what all we have, you can go on the website as well. And I would request you guys that you become members of the association. We have to increase the strength that we have. You have to conduct such sessions. Next time, if you are expert in some field, if somebody is doing cosmetic surgery or somebody is a dentist, then she or he can share their experiences, teach other dentists about the pathway and guide them in their career ladder. Obviously, it's not consulting. Let me remind you again and again, for a way which the doctors were already here to like bring them together, to network, to integrate, so that we all benefit from this association. All right. So I would request you guys to go on the website, take the membership, send your documents, which is required over there through email. And yes, and I wish you all very fire targets or very happy holidays. The Germany's holidays at present. Abhinav, you want to say something?
I would again thank you very much for conducting this session, Deepak, because you have taken this initiative. I think the most important step is the first step to start any personal, any such thing, and very grateful, and I acknowledge it very much that you have taken this such initiative and such step. Again, thanks a lot.
You're welcome, Abhinav, and thank you all once again for participating. And once again, I mean, yes, as you said about first step are good, but it's not enough. So the following steps have to be taken. Definitely. And you cannot rely on me all the time. Like I'm talking about other members, that you cannot just be the passive, that okay, somebody's taking the step and then we'll just follow. No, you have to be active. I believe in creating opportunities and building value for everyone around you. And I would rather like, instead of just speaking for two, I would be I will appreciate it when somebody from these participants next time write to me that okay, I want to present this and I want to do this. I will be very happy to accommodate that. All right, then with this, we'll conclude this video here. And importantly, before I close this, I want, as I've also written, that this is recorded and this will be posted on YouTube or other social media that I like do very commonly. So if you have any problem with your names coming up somewhere, then you let me know. We will edit it so that it does not come. Okay, because I hope that, or I wish that other, not just 15 participants, I wish that other hundreds and hundreds of people who will watch this video also benefit from the information that we have talked about today. All right, do write to me if you have anything against it. We'll take care of it. All right then, bye bye.
Bye bye.
Thanks a lot. Thanks. Thank you all.